Hi, my name is Ashton Willoughby. I'm a registered nurse. I plan on graduating with my BSN degree this fall. I currently work in an oral surgery clinic within 5 facilities in this state of Kentucky, and I travel to the OR with our oral surgeon in the hospitals. So the final capstone presentation that I'm going to do is over timeout procedure in the surgical setting. The purpose for this project is to improve communication within the surgical setting to improve patient outcomes. This project is related to the QSIN competencies of teamwork, collaboration, and patient safety. The clinical example that I witnessed within our facilities is as follows. The patient arrived at our outpatient oral surgery clinic for multiple teeth extractions under IV sedation. The patient was one of many surgeries in our clinic. It was very busy that particular day as the schedule was overbooked, and the staff, of course, the rush to turn rooms over. The patient was prepped for surgery. IV sedation was administered. This surgeon began extracting teeth as in the treatment plan. However, the problem with the clinical scenario, the surgeon extracted the wrong tooth on the patient during the surgery. And also, the team members did not recognize the event until the surgery was over. The timeout procedure was not performed effectively, as it is not a standardized protocol within our practice. So the obstruction in communication among team members compromised patient safety, resulting in an error that could have easily been prevented, which would be our sentinel event. So the implications for study. The issue of ineffective communication and resulting negative effects in the surgical setting can have drastic effects on patient outcomes. In an environment in which communication is obstructed, patient safety is compromised because team members are not working collaboratively. The incorporation of a timeout procedure in the operating room can improve communication among team members, thus preventing errors and improving patient outcomes, which is our main goal. So background on the timeout procedure. A timeout procedure is a universal protocol. It's implemented by hospitals in alignment with the Joint Commission is to reduce the likelihood that surgeries will result in errors or adverse outcomes. And according to the Joint Commission, there are 3 pieces of information that must be confirmed prior to a surgical procedure. The first, the patient's identity must be correct. The site of the procedure must be correct, and the procedure being formed is correct. This should be communicated. All 3 of the points the Joint Commission requires. This should be communicated with all providers on the care team in the operating rooms. Why? Because this ensures that all care team members are in agreement as to what is happening to provide care to the patient. The process of the timeout procedure is intended to eliminate incorrect procedure or procedures at incorrect sites. This results in an increase in positive patient outcomes and patient satisfaction, which improves the quality of care provided to the patients. So throughout research for this project, there are certain themes that can be brought about. The main one, need for communication, is the strong emphasis. Throughout this research, there's a strong emphasis on the need for communication in healthcare settings. Implementing education and training not only facilitates improved communication, but it increases patient safety. Without standardized protocols such as timeout procedures, many surgical team members experience near misses or mistakes, including patient identity, surgical sites, and procedures. For facilities that have already implemented a form of timeout procedure protocols, as our facility, there is a need to examine the use in the care setting to ensure that the procedures are used appropriately and effectively, thus reducing errors and resulting in positive patient outcomes. The proposed solution for the ineffective use as in our facility of the timeout protocol is to develop a dialogue framework for timeout protocols to replace the checklist currently used in our surgical care setting. The dialogue is intended to facilitate greater communication among care providers and reduce errors that can occur in spite of the current use of the timeout procedure. The dialogue framework will be adapted from the existing checklist that we use. Instead of the checklist with the yes or no answers, care members will conduct the checklist in a question-answer format. This framework will facilitate improved communication among care providers to ensure that the proper procedures for the appropriate patients in care settings. This will reduce the occurrences of errors in care procedures and will result in improved patient outcomes and satisfaction in care settings. Objectives. Through timeout protocols that are effective, they do not always foster the effective communication intended due to the use of cursory checklists, just with simple responses. They're not always appropriately adhered to by care providers. This is a specific problem that needs to be addressed as far as using yes, no answers instead of open communication. Addressing the following objectives will facilitate improved communication and outcomes among the care providers in the surgical settings. These objectives also form the foundation of the implementation plan for a proposed solution and can also measure the overall success of the interventions after they have been put in place. These are the following objectives. The first, increase communication that takes place among care providers during timeout protocols. Develop a dialogue for care providers to use in timeout protocols to replace the current checklist structure, the yes-no structure. Reduce the number of errors that occur in surgical settings with timeout protocols in place. So this is the implementation plan. The first part of the plan is, of course, education. All relevant staff members, including surgeons, nurses, and surgical assistants, they will undergo education sessions in preparation for the plan of the new dialogue framework. The education sessions will explain the change, the rationale behind it. Once the education sessions are complete, the plan will move on to the training phase. The training phase of the plan, the implementation team will facilitate the training sessions. In these sessions, care members will do mock dialogues in preparation for the implementation of the dialogue framework. The training sessions can be developed from past patient scenarios, particularly in which errors have occurred, as in the clinical scenario that we witnessed earlier. These training sessions are intended to give care providers the opportunity to practice dialogue framework prior to using it with the patients in surgical procedures. Through these training sessions, care providers can ask questions and address challenges associated with the implementation plan prior to the application of the dialogue framework in actual care scenarios. So for an example dialogue framework, the confirming part of the timeout procedure following dialogue would take place. The nurse would ask what is the procedure to take place for Joe Doe. The doctor would then answer tooth extraction number 32, and then the doctor would immediately respond, what is the procedure for this patient? And the nurse would immediately respond to him, tooth extraction number 32. Both people are confirming the same. The application part of the plan, after the education and training phases are complete, the application part of the dialogue framework can be put in place in the care setting. The care provider should be informed of a specific start date for the dialogue framework, After this date, all surgical care providers should be expected to use the dialogue framework instead of the timeout checklist procedure previously used, the yes/no format. This can be confirmed through examination and analysis of patient charts on a regular basis. Evaluation is just as important as the first parts. In order to ensure that the dialogue framework is accomplished, the objectives in improving patient outcomes, it must be evaluated. The evaluation process consists of two components: patient data and care provider perceptions. The information gathered from these two components will provide the information needed to effectively determine the success of the intervention. Patient data will be gathered from patient charts to determine the correlation between the use of the dialogue framework and reduction in errors in surgical procedures. The patient charts will include the dialogue framework that is signed, has a signed confirmation, as well as notes from any errors or complications that occurred during the procedure. This data can be compared with error rates prior to the implementation plan to determine a quantitative impact on the quality of care at the facility. The examination of the data can be a way to monitor the effectiveness of the dialogue framework on an ongoing basis. In addition, it is recommended that the facility incorporate surveys to be completed by physicians and nurses using the dialogue framework. This will provide a qualitative aspect as far as effectiveness and overall success of the intervention. It is an important component because while it's necessary to improve the quality of care to patients, it must be done in a way that can be maintained by care providers. If the dialogue framework is not working for the care providers, they're less likely to adhere to it, which negates the entire effort of the implementation. As with the quantitative data, the surveys can be repeated on a regular basis to monitor the effectiveness of the intervention. So in conclusion, timeout protocols, they are an effective evidence-based practice to improve communication among care providers in surgical settings. However, through the implementation of a dialogue framework, communication can improve, which will improve the quality of care provided to the patients. In this way, care facilities can gain the benefits of timeout procedures while avoiding the challenge of lack of adherence or effective use of the protocol among staff. All in all, this will help make the intervention more effective for all involved, which is the ultimate goal. Thank you.